This is Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal.
Hello, I'm Peter Anthony Holder. Welcome to this edition of Your Health. November 21st is World COPD Day. It's organized by the Global Initiative for Chronic Obstructive Lung Disease in collaboration with healthcare professionals and COPD patient groups throughout the world. COPD stands for Chronic Obstructive Pulmonary Disease, a chronic disease characterized by shortness of breath, cough, and sputum production. Dr. Nathalie Saad is a respirologist at the Jewish General Hospital, and she's also the director of the Outpatient Pulmonary Rehabilitation Program at Mount Sinai Hospital. Dr. Saad, we live in a world where we're seeing more cases of COPD. Traditionally, it was something that only appeared in people age 55 and older. Is this a growing concern because we have a larger population who have reached that age, or is it something that is more environmental as a cause?
COPD is a real concern in our Quebec society right now. It is the number one cause of recurrent emergency room visits. So we know how crowded our emergency rooms are, and COPD actually represent a big proportion of the patients coming to the emergency room very frequently. It's also a concern because COPD used to be a disease of older people, and more we're seeing younger women. So the age of 55 you're quoting is unfortunately the new patient population we're seeing. So younger women that are still working and that are smoking. So cigarette smoking is still the number one cause of COPD, unfortunately. And it is unclear right now why women seem to be more affected by COPD and affected at a younger age. It may have to do with the fact that women may have smaller airways, smaller lungs, and thus smoking cigarette is more damageable, although this is yet to be proven. So this is why we need to find ways to address smoking cessation efficiently, and thankfully in Quebec we have centers all across the province that really help patients quit smoking, and we also need to address and optimize the management of the disease to prevent those recurrent emergency room visits and improve our patients' quality of life.
You mentioned smoking is the most common cause of it, but there are others. What are some of the others?
So there are other causes of COPD, although to be honest, they're in a much smaller proportion compared to cigarette smoking. Cigarette smoking still represents about 90% of the cause of COPD in our current patient population. It is true that some work-related exposure to certain products in particular can cause COPD. There are environmental exposures too, but they represent a very small proportion of our patient population, cause of COPD in our patient population.
And when dealing with COPD, I understand one of the ways of control it is using an inhaler. Tell us the role that an inhaler plays in this.
Yes, so like in any other chronic disease, COPD is managed first with non-pharmacological approaches, so smoking cessation, vaccination, and pulmonary rehabilitation. But it is also very important to add to that non-pharmacological approach the use of an inhaler. Inhalers, we have a few categories of inhalers. They act differently on the lungs, and more specifically on the pipes of the lungs that are damaged in patients with COPD. And what most of those inhalers do is they help open up the pipes of the lungs. So COPD is really a disease where the pipes of the lungs are not letting the air flow as well as we would like. In particular, patients have difficulty breathing out. So what those inhalers do is they actually help facilitate the movement of air through the pipes of the lungs by opening up the pipes of the lungs. We also have some medications that quiet down the inflammation or the excitement at the level of the lung to help reduce secretions and symptoms.
Now, I understand that you recommend people getting flu shots if they have COPD. So what role does getting the flu, or what is the concern about getting the flu for someone who has COPD?
So both the inhalers and the flu shot play an important role in the prevention of what we call exacerbation. So an exacerbation is an acute deterioration of the disease. When getting the flu shots, we know it's not perfect, and as you probably hear in different medias, the flu shot will never be perfect, and we're not aiming at it to be perfect. It'd be great if it was, but we know that it will never cover all the strains of flus that we see, and definitely doesn't cover all the viruses. But what it does is it helps prevent some of those exacerbations in our patients. Every time a patient gets an exacerbation, so an acute deterioration of their symptoms, their risk of complication increases, so the risk of ended up in an intensive care unit, maybe requiring some machines to help them breathe, are higher in patients with COPD. And also the risk of other complications such as pneumonia, again, maybe requiring a stay in the hospital. We want to decrease the risks of exacerbation as much as possible, and that's why the flu shot is very helpful. The other complication of an exacerbation that we want to prevent is because in the long term, an exacerbation could be just like a heart attack but for the lungs. So patients can end up losing some lung functions after an exacerbation. So anything we can do to prevent those exacerbations should be done, and proper use of inhalers and the right type of inhalers and the flu shots are definitely the best way to go about doing this.
The first letter of COPD is for chronic. Is COPD something that can be reversed, or once a patient has it, they have it for life?
COPD is a chronic disease, so once you have COPD, you have it for life. It is just like hypertension or diabetes. Education, prevention, stopping the agent causing the disease, and optimizing the management of the disease are at the cornerstone of how to make our patients feel better and enjoy a good quality of life and be as active as possible. But it is a chronic disease, and it stays with you when you have it.
How important, you talk about quality of life, how important is exercise in this?
It is actually the best tool we have to improve quality of life. It works better than any other inhaler we have, and that's why pulmonary rehabilitation is an essential piece of the management of COPD. It serves two purposes. So pulmonary rehabilitation is a program that, yes, includes exercise, but also includes education. So we know that for any chronic diseases, understanding the disease, understanding how to manage the disease, how to prevent complication of the disease is essential, and it allows patients to take ownership of the disease. So pulmonary rehabilitation offers both the education and the exercise part. When the lungs are sick, patients feel very short of breath doing any activity. The way to overcome this challenge is by making the heart and the muscles, so the rest of the body, compensate for what the lungs can't do as well as we would like them to do. So exercise allows to rebuild muscle mass and allows training of the heart or training of the cardiovascular system. And through exercising, patients manage to do way more, despite the fact that their lungs are compromised.
And for about a year now, there's been a remote pulmonary rehabilitation program at Mount Sinai Hospital. Could you give us a brief update as to how that is working out?
Yes, so the biggest challenge with pulmonary rehab in Canada, and to be honest, worldwide, is access to that service. we're very lucky in Quebec in that we had a few programs on the island of Montreal, some programs in Quebec City, and a program in Sherbrooke, with a few decentralized groups all across the province. But that being said, less than 2% of the patient population that actually needed access to pulmonary rehab had access to it. So Mount Sinai and the CIUS decided to see what could be done to try to improve accessibility to that very important part of COPD management. And we created the Telepulmonary Rehab Program to improve accessibility to that service and to that piece of management. So we are currently in 8 different sites all across the province, from l'Outaouais to l'Abitibi to La Naudière. We're in Montmagny, and we are also in a few different healthcare centers on the island of Montreal. And since January 2017, we've managed to offer the full 8-week program to over 150 patients across the province, which means now, hopefully, that sites will be convinced it is a necessary services, and we'll see more sites join our telepulmonary rehab program.
That was Dr. Nathalie Saad, a respirologist at the Jewish General Hospital and the director of the Outpatient Pulmonary Rehabilitation Program at Mount Sinai Hospital. For their programs, you will need to be referred by a physician, and for more information, you will find phone numbers and links on our site. And that's it for this edition of Your Health. Again, we remind you, if you missed any of our previous programs, you can find them archived on our website at podcast.ciuswestcentral.ca. That's podcast.ciuswestcentral.ca. You'll find there all the information, such as links or phone numbers that we've mentioned in the show. Also, feel free to drop us a line if there is a topic or area of discussion that you'd like us to explore on future shows. I'm Peter Anthony Holder. Thanks for joining us.
You've been listening to Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal. Join us next week for another edition of Your Health.